So in the your topical drops, generally we are using the buffering agent, pH adjuster, stabilizer, solubilizing agents, then viscosity enhancer, and other kind of material like co-solvents as well as the main solvent. Now, what is the role of tonicity and tonicity adjusting agents? So, tonicity is nothing but we can say your preparation must have the adjusted tonicity to your lacrimal secretions. Otherwise, your eye drop or the eye preparation may cause the irritation as well as the redness or any kind of serious problems or the sensations to your eyes. So, to avoid the such kind of problems, your preparation must be isotonic with the lacrimal fluid, so that tonicity can be adjusted by using the various kind of methods which are earlier we have discussed. Most of we are using the 0.9% sodium chloride to adjust your tonicity. Generally 0.5 to 2% of sodium chloride solution is equivalent to the your lacrimal secretion, and it is not causing the any kind of irritation. So your eye drop may range into the 0.5 to 2% of sodium chloride equivalency or the isotonicity. So commonly, we are using the sodium chloride or potassium chloride, then some buffering salts, as well as the buffers, dextrose, glycerin, propylene glycol, as well as mannitol for the adjustment of your tonicity of the preparation to make it isotonic with your solution, lacrimal secretion. Generally when we are adding the your preparation into your eye, so there is the one range that is from 0.6% to 2%. Such kind of solutions of sodium chloride are having the we can say marked discomforts, or they are not tolerated by their eyes. So there is a redness or the itching or the we can say irritation. So such kind of problems may arise if the 0.6% to 2% of sodium chloride solution if you are adding. So generally, after that, we require to adjust the pH of your preparation, as well as the we have to maintain the required pH by using the various kind of buffering agents. So when we are requiring the we can say constant pH, it means sometimes your drug is not having the proper solubility in other pH. So we have to maintain the required pH, then only it will be always soluble throughout the life of your product. So we have to adjust the pH of your preparation. So in another way, we can say your pH adjuster or the buffering agent is rendering the more stability of your product, as well as it is providing the comfortness as well as the safetiness and activity of your internal drug into the formulation, and it can avoid the possible eye irritation. Generally, suppose the pH is not suitable or pH is beyond the 7.4 or below the 7.4, so then also it can cause the irritation to your eyes. So to maintain the required pH, that is 7.4, so it is pH of your tear. So sometimes pH may get changed, and suppose the pH has been get changed, then it may cause irritation. So to avoid that pH change also, we require to add the your buffering agents, which will avoid the possible irritation of your eyes. Then sometimes we may require to add your buffering agent to maintain the constant pH for the solubility of your drug, as well as to enhance the drug viability, as well as to enhance the preservative efficacy of your product. So there are the various we can say means. For that purpose we are adding the buffering agent. Primarily we are avoiding the changes in pH because your drug is may get we can say crystallized or it may be precipitated. So to avoid that things, we are adding the buffering agent. Then pH adjustment, generally we are using the 7.4 pH because your tear pH is also 7.4. So most of time we are trying to adjust the solutions pH or the your product pH as equal to your tear space to avoid the any kind of discomfortness. But sometimes at the 7.4 pH, some drugs like alkaloids are may get we can say precipitate because they are not having the suitable 7.4 pH. So in that case, they may become unstable and they are not chemically we can say useful for the your treatment purpose. So in that case, we have to select the such kind of buffering system which can maintain their solubility overall throughout their product and throughout the life of that product, and it may avoid the irritation of your eyes also. Next case is the stabilizers and antioxidants. So stabilizers are the ingredients which are added to your preparation to decrease the rate of degradation of your product or the rate of degradation of your drug. So they are called as the stabilizers. So the examples is nothing but the antioxidants. Generally, we are using the antioxidants to avoid the oxidation of your drug. So in the same way we can say, or in another way we can say, your antioxidant is nothing but the stabilizer of your product. Because if you are not added the antioxidant, oxidation may take place and it may cause the damage of your drug. So this is nothing but the one we can say stabilizer come as a antioxidants. Then the example is the sodium bisulfite, metabisulfites are generally used in the concentration of 0.3%. Okay, this is very we can say important that we have to maintain the concentration which is provided by the standard books. If we are increasing the concentration, then it may cause the problems in the your formula or the patient's problem. Then surface acting agents. Generally, we are using the surface acting agent to increase the solubility of your drug. So many times we may need to add the your surface acting agents, especially when we are preparing the we can say your solutions as well as when we are preparing the surface suspension also. So at that time also we require the surface acting agent or as a wetting agent. So in this case we have to maintain the given criteria. Generally the anionic type of surface acting agents are a little bit harmful than the cationic, and cationic are harmful than the non-ionic. So this is the you can say sequence of harmfulness or the toxicityness. So several non-ionic surfactants generally we are using in case of your eye preparations to improve the solubility of your drug and to achieve the clarity of their solution also. Generally sorbiton, then polysorbate 20, twin 20 and twin 80. These kind of surface acting agents are preferred in case of the ophthalmic preparations. Then viscosity imparting agents. Now what is the main role of viscosity? Viscosity modifier are those agents which are added to increase the viscosity of your preparation. Now what is the role of that viscosity in this preparation? When we are adding the viscous preparation into the eye, then it will not easily flow down from your eye. It means it will take the little bit time compared to the normal liquid. So here contact time of your preparation is more with your eye compared to your normal preparation. What I am saying, the viscous preparation will have the more contact time with your eyes than the normal preparation. If you are adding the normal distilled water or the normal fluid or the normal dose of that preparation, which is not having maintained required viscosity, then it will easily flow down from your eye cavity. So it will not having the more viability. But instead of that, if you have increased the viscosity of that preparation, then it will have the more contact time with your eyes. So this is the first we can say advantage of the viscous preparation. Then when we are adding the viscous type of preparation into your eyes, generally they can decrease the drainage rate of your tears. So the lacrimal secretion will be decreased if you are using the viscous kind of solutions or the eye drops. Next advantage is that because of the more contact time and maximum dose is remaining inside your eye cavities, we are getting the maximum viability for that drug. So these are the advantages of your viscous kind of preparation. So again, I would like to repeat it. When we are using the viscous kind of solutions or the eye drops, they are having the more contact time with your eyes. They are having the ability to decrease the lacrimal secretion flow, as well as they are increasing the viability of your drug. So this is the advantage of your viscous kind of eye drops. But along with this advantages, some disadvantages are also there. When we are using the viscous kind of preparation, generally they produce the blurred vision, because when we are using the dry viscous kind of preparation, so you cannot see through that solution, because it is administered into the your eyes. So easily you will not see, or you cannot visualize. And when they are becoming the dry, when your administered dose has been finished after a particular time, the viscosity enhancing agent will form the we can say film around your eyes. So that will cause the sometimes we can say difficulty in visualization, or blurred vision will be there. And while preparation of such kind of viscous eye drop, it is quite difficult to filter that eye drop through the your various kind of filters, because when you are filtering the viscous kind of preparation, they are taking the too much time, and they are having the difficulty for the filtration compared to the normal filters. So these are the we can say small disadvantage of the viscous kind of eye drops. Again, I would like to repeat it. Viscous kind of eye drops can cause the blurred vision, and they are quite difficult to filter from the filter. So this is the we can say disadvantages. Generally, we are using the polyvinyl alcohol as a viscosity enhancer, then hydroxypropyl methyl cellulose as a viscosity enhancer for the ophthalmic preparation. So depending on the requirement, we may use the such kind of viscosity enhancer. Then vehicles. This is the most important, we can say, ingredient of your ophthalmic preparation, because a vehicle is taking the your all the ingredients. Most of time, only vehicle and drug has been used. Okay, most of cases. When it is required, then we are adding the buffering agent as well as the viscosity enhancer or the isotonicity adjuster. Otherwise, only vehicle and drug is sufficient for the treatment purpose. So vehicle is also important one. Most of time we are using the distilled water as a vehicle, or purified sterile water for injection as a vehicle. Sometimes distilled water, reverse osmosis water, deionized water can be used. Okay, or the process like distillation, deionization, and reverse osmosis is used to kill the microbes from that your water, and to make it very pure. Then instead of the your water, we can use some oils also as a vehicles, because depending on your drug and sensitivity, sometimes we may require the change of vehicles. So instead of water, we can use the oil. Then, regarding the packaging of your eye drops or the eye solution and eye suspension, generally they are packed into the plastic containers. Previously, we were using glass bottles, but nowadays we are having the plastic containers with the same, you can say, utility as like as your glass bottles. So that's why, because of the you can say cheaperness, because of the you can say less fragileness and transparency, as like as your glass, we are using the plastic bottles or the plastic droppers and bottles for the packaging of your eye solution as well as the eye drop and eye suspension. Generally, it is having some disadvantages, advantages to your eye drop. That is the they are very much convenience. Then there is a decreased contamination. Then low weight, because plastic is having the low weight, and low cost compared to the glass, and low production cost because and transportation cost, because plastics are having a less weight or light weight than the glass bottles. So that's why we are using them, and they are having the flexibility. Uh, then special kind of ophthalmic packages are also available, like polypropylene. One derivative is introduced recently. They can be used. And another thing is that this polypropylene is having the stability at the higher temperatures. Suppose you have filled any eye drop into the polypropylene plastic container and you want to sterilize it at 121 degrees centigrade, then also it will be stable at the higher temperature. So by this way, these plastic containers are having the, you can say, ability to stand at the higher temperatures. Sometimes we may use the glass bottles also. Previously we were using the glass bottles and they are having the one ability. They are transparent one, clarity one, and they can stand at the higher temperatures also for the autoclave sterilization also, as well as the dry heat sterilization also. And most of time we are using the amber glass bottle for the light resistance. So this was about the solutions and suspensions. Now the semi-solid dosage form like ophthalmic ointments and the gels. So most of time we have used ophthalmic ointments as well as the gels for the treatment purpose. So the ointments and gels both are viscous in nature. So the main advantage for the ointments and gel is that they are having the more contact time with your eyes than the your eye drops or the your eye suspensions, because ointments and gels are remaining long time. They cannot flow down from your eyes easily. So that's why they are having the more contact time with the drug, and that's why that drug will be released near about 100% or the 90% into your eye cavity, or it will be absorbed because of the more contact time. So compared to the your eye drop as well as the eye suspension or the totally liquid dosage form for the eye purpose, so your ointments and gels are having the more viability. Generally, ointments vehicles are used as mixture of mineral oil as well as the petrolatum base. And generally, we are using the some mineral oils to modify the melting point of and consistency of your ointment. Then petrolatum vehicle is also used to give the lubrication property to your eyelids. Generally, in some cases, you may have the itching or the irritation because of the presence of the dust. So in that case, lubrication is essential. So to give the lubrication property, generally petrolatum is used as a lubricating agent. Generally, they act as a protective layer between your eyelid and your pupils. Generally, such kind of ointments and gels are administered most of time at the night time. So it will be quietly comfort for the, you can say, absorption of your drug. And main problem is that when at the daytime you are administering the your ointments and gels, so the viscous preparations are having the one problem. I have already told you that there is the blurred vision because of the viscosity. That's why when we are administering the ointments and gels at the daytime, so generally it will quite having the difficulty for the clear vision. So there will not be any clear vision because when you are administering the at daytime. So that's why ointments and gels are most probably used at the night time. Generally, chlorambutanol and methyl and propylbene are as most probably used as a preservative. Chlorambutanol and methyl and propyl paraben. So these paraben derivatives are most probably used for the all kind of ophthalmic preparation. The disadvantage of ointments and gels are that they are quite greasy in nature and they can cause the blurred vision when they are applied. Generally, manufacturing for the of your ophthalmic ointment. So these ophthalmic ointments are prepared just prior to preparation. The whatever the base is there, so that will be sterilized by the heat sterilization method. Okay, and then it will be filtered for the removal of the any kind of presence of the foreign particles. And then after that, we will mix other ingredients which are already sterilized, and then they will be mixed with your molten ointment base, and then we have to mix it thoroughly till we can say uniform mixture is obtained. Then after that, all the mixture we have to pass through the sieve, and we have to go for the colloidal mill, because sometimes your drug may having the some particulate matter may not be completely we can say mixed, or your size may have the we can say larger. So for that purpose we have to pass through the colloidal mill to reduce the size and to obtain the adequate dispersion or the uniform mixturing of your total preparation. It means whatever the drug, whatever your other ingredients we are adding into your base, so that all should be equally distributed throughout your base. For that purpose, and to reduce the size of your any kind of drug particles purpose also, we have to pass it through the colloidal mill. Then finally it will be filled inside your final container. Then generally your ointments are packed inside the small collapsible tubes. Everybody might have seen the collapsible tubes. Nowadays we are having the toothpaste in the collapsible tubes. Simply you have to press it gently, you will get your product. Generally 3.5 gram of the we can say capacity of that tubes are there. We are using for the filling of your ointments. Previously, we were using the aluminum tubes for the filling of the ointments, but nowadays we are having the variety of the plastics, and they are having the one advantage that they are having the flexibility and good collapsibility. So immediately, when we are pressing them, they will remove your product also, and they will regain their own position. So elasticity is there to your plastic container, or the you can say they are having the rigidness. Sorry, you can say plasticity. So aluminum tubes are having the one disadvantage that once you have pressed it, they will never regain their own shape. So that's why we are avoiding the aluminum tubes. Another disadvantage of aluminum tube is that they are costly compared to their plastics. And another thing is that sometimes aluminum tubes may release their own material inside your ointment, so it may cause the irritation to the eye. So that's why nowadays small collapsible tube made up of the plastic are preferred for the filling of the ointments. Generally, these tubes which are filled inside the plastics, they are we have to check for its leakage purpose, because sometimes there might be chances that your ointment may be leaked initially, or when you are filling your ointment into your container, it may be semi-solid. But while transportation, if your vehicle is passing through the hot region area like Rajasthan, or suppose you are sending your material into the Africa where the high temperature is there. So here what will happen? There might be chances that your ointment may get we can say melt inside your container itself. So during that process, it may leak out from your preparation. So to avoid the such kind of problems, we have to check the leakage test of your product. So for that purpose, uh, we are having the particular type of test for that kind of container. So in next we will see that type of test. Then how to use your ointments as well as the gels properly. So generally, when we want to use your gel or the ointments for the eye purpose, so initially we should sanitize your hand and wash out it properly, and then with the one hand we have to stretch out the one eyelid, the lower eyelid, and then by the another hand, by the left hand side, we have to stretch your eyelid, and by the right hand or another hand, just uh, press the your tube and add the 2 or 3 drops, or as per the required dose we have to add, and then slowly relieve your uh, eyelid, and you can say keep your eyes closed for the particular period. Then till the complete absorption of your dose, we should not open the eyes. So this is the one you can say correct way for the application of the ointments as well as the gel. The next is the your solid dosage forms. Now, initially we have seen the solutions, suspensions, and then gels, and then ointments. Now, because of the modern technology as well as instruments, and because of the modification in the your everything, we have developed the solid dosage forms for the eye, or the we can say these are the sustained release type of dosage forms we have developed for the ophthalmic purpose. Generally, to avoid or to overcome the disadvantages of liquid dosage forms, to overcome the disadvantages of your ointment and gels, we have developed the ophthalmic inserts, or they are called as the ocular inserts or the modified solid dosage forms. So generally they are, we can say, defined as they are the sterile, solid, semi-solid preparations with thin, flexible and multi-layered structure for the insertion into the conjunctival sac. So such kind of ophthalmic inserts generally we have to keep inside your eyes for the longer period, and for the longer period they will deliver the drug to your eyes, or for the treatment purpose we are keeping them inside your eye cavity for the longer period, and they are not causing any kind of problem, or there will not be any kind of irritation or the side effects. So normally you can do your work and they will remain inside your eyes without any kind of problem. They will remain there and they will release their drug. So when we require the longer treatment for the your eye purpose, so in that case we can use such kind of ocular insert. They are made up of using the various kind of polymers, and they are we can say non-reactive, non-toxic to your eyes. What are the advantages of such kind of ocular inserts? Generally, such kind of ocular insert is having the main advantage is that they are having the long contact time with your eye. It means compared to the liquid dosage forms, compared to the semi-solid dosage forms, your eye occlusals are remaining inside your eyes for the longer period. That's why there is the more contact time of the drug with your eye cavity, and that's why there is the improved viability, or you are having the high viability or the more viability compared to your oils, compared to your solution suspension. Then another advantage of this kind of solid dosage form is that they are providing the prolonged drug release inside your eye. Prolonged drug release means what? For the longer period, not only for the 10 days, but they can deliver the drug for the month as well as the, we can see, years also. So depending on your requirement, we can use the such kind of eye occlusals which will provide the continuous release of the drug for the longer period. So no need to take the dose every time. Once we have administered this Acusat, it will release the drug, and that patient have not or no need to take the that drug. So this is the advantage of this kind of solid dosage form. Then it is reducing the adverse effect, because in case of eye drop, sometimes you may not have the ability to measure the accurate dose. Sometimes you may administer the extra dose, or sometimes that preparation itself may cause the adverse effect. So in this eye episodes, such kind of problems are minimized. Then another advantage of such kind of eye occlusal is that there is a reduction of the number of administration and thus better patient compliance. It means I have already told you that no need to administer the frequently your doses. Once you have insert this occlusal, it will automatically release the drug. So this is the these are the advantages of your solid dosage forms. Then types of your ocular inserts, that is the insoluble ocular insert and soluble ocular insert. Now insoluble ocular insert are those inserts which are not having the solubility in your eye or in the your eye solution. That's why they are called as the insoluble inserts. Generally they are multi-layered. Multi-layered means while preparing these inserts, generally they are having the ring shaped structure. This is I have shown in the figure. See here, such kind of rings are there. So while preparing such kind of rings for the insertion inside the eyes, so that rings are prepared by using the number of layers of that polymers, and in that we are containing or administering the drug as a core material, and around that drug we are giving the core surrounding of the other material or the by using the polymeric membranes. So your drug is surrounded with the other type of material like polymers. So this is the structure of your eye accusats which are insoluble in your eyes. Generally, in case of insoluble insert, the speciality or the features of insoluble inserts are they are having the we can say longer period of drug release. Means for the longer period they are delivering the drug. Then the rate of drug release from that eye occlusate is controlled. It means as per the your we can say required or the estimated time your drug will be released from your eye occlusats. So it is the we can say pre-decided one that how much amount of drug should be released per day from that eye occlusate. So by using the various kind of membrane we can decide that how much amount of drug will be released from your eye occlusate. So per day 1 mg, per day 2 mg, whatever the quantity is decided by you, that can be controlled for the per day release. Then such kind of diffusion of the drug is controlled by using the polymer composition or by using the various kind of polymers which are having the ability to control the drug release from your icosates. Then sometimes we can use the membrane thickness as a we can say one technique for the release of the drug as per your predetermined manner. And depending on the solubility of the drug also we can decide that how much drug should will be released from your acousate time to time. So these are the three we can say basics, that is the polymer composition, then membrane thickness and solubility of the drug. So by using three we can say technique we can decide or we can fix the amount of drug will be released from the your eye acousate time to time. The example of such kind of insoluble eye occlusate or the eye insert is the occlusate R, occlusate Pillow 20 and occlusate Pillow 40 for the ocular systems. So it is the we can say available in the market. Generally, it is used for the 7 days purpose for the treatment of the glaucoma. And pilocarpine is the drug is already administered inside that occlusate. When we are inserting it for the 7 days, it will continuously release the pilocarpine. So it is used for the treatment of the glaucoma. See, this is the I have shown the picture. Such kind of rings we have to insert in your eyes, so it will not cause any kind of irritation and it will remain as it is there. Then next point is the soluble kind of ocular insert. So this kind of ocular insert will get completely solubilized inside your eye solution and no need to remove them after the utilization. So this is the called as the soluble insert. So soluble inserts are consist of monolithic polymeric devices that at the end of their release, the device dissolves or completely erode inside your eye solutions or the lacrimal secretion, and it will be absorbed inside the eye itself. So generally, by using the natural polymers, we can prepare the such kind of soluble insert. For example, collagen can be used as a polymer for the development of such kind of soluble insert. Some other kind of material also are there. That is the some synthetic and semi-synthetic polymers are there, like cellular derivative. For example, hydroxypropyl cellulose, methyl cellulose, polyvinyl alcohol, ethylene vinyl acetate can be used to prepare the such kind of soluble insert. Generally, when we are inserting them inside the eyes, within 10 to 15 minutes, they will get softened because they will absorb the lacrimal secretion and they will get soft. And after the introduction into the upper pharyngeal sac, gradually they will get dissolved and within the 1 hour inside your eye cavity. So as like as your tablet, when we are administering them to the upper sac of your eye, they will get immediately dissolved within the 1 hour. So after the 1 hour, they will vanish or they will completely absorb from your eye cavity. So these are the we can say advantage of this kind of preparation, that when we are administering them, no need to take out or the no need to remove them after the utilization. The example is the we can say Lacrisert is a sterile ophthalmic insert nowadays available for the treatment of the dry eye syndrome. Lacrisert is the prepared soluble ocular insert is available in the market for the treatment of dry eye syndrome. It is containing the hydroxypropyl cellulose and generally it is rod shaped in 1.27 mm in diameter and 3.5 mm in long. Then intraocular dosage form, they are the ophthalmic products that are introduced into the interior structure of the eye primarily during the ocular surgery. So this kind of you can say devices are inserted by surgery method, and we have to insert them inside your eye structure. So in case of interior structures, when we are administering them, slowly they will release their drug. So generally they should be we can say pyrogen free as like as your parental preparation. So they should be sterilized one and free from the microorganism. Then there should be strict control of particulate matter while inserting them inside your eye cavity, and they should be packed as a preservative-free single dose. So while preparation of the intraocular solid dosage form, so that preservative should not be administered with them. So such kind of we can say specification we have to maintain, or the requirement of that formulation we should maintain. So what are the such kind of intraocular dosage forms? So first example is the irrigating solution. So while surgery we require the such kind of irrigating solution. That's why they are called as the intraocular dosage forms. So it is balanced salt solution and was developed for the hydration and clarity of the cornea during the surgery. Generally, when we are doing the surgery of your eye for the any other purpose, so there might be chances that bleeding or any other particle may stick to your apparatus while surgery, or it may cause the we can say contamination in your eyes, or the foreign particle may insert into your eye while the surgery. So for the cleaning purpose, for the we can say hydration purpose of your eye cornea, so we require to use the such kind of irrigating or the washing solution. Generally, such kind of irrigating solution contain the sodium, potassium, calcium, magnesium, and well as chlorides. It contains the citrate, acetate, ions, and potential source of bicarbonate. They are formulated to be a isoosmotic with the aqueous humor and has a neutral to slightly alkaline physiological pH. Generally, they should be non-pyrogenic one, and they must be sterilized prior to utilization. So these are called as the irrigating. Now the intraocular dosage forms. The example is the intraocular injections. So these are the nothing but the parenteral type of dosage forms. Generally, in case of emergency, we are using them to deliver the your drug to achieve the required therapeutic concentration immediately. So into the intraocular cavity, we are administering such kind of injections. So generally, we are using the FDA approved intraocular injection like viscoelastics as well as the antiviral agents, then intravitreal injections and myotics agents. Generally, such kind of agents are using for the treatment purpose of your eyes. Then intravitreal implants are there. What are the such kind of intravitreal implants? So these are the sterile devices containing the ganciclovir as ingredient or antineoplastic drug as a like as a tablet of ganciclovir with the magnesium stearate and is coated to retard the leads with the polyvinyl alcohol and ethylene vinyl acetate polymers. Such kind of devices surgically implanted inside the eyes for the delivery of the drug for 5 to 8 month period. So for the longer period, we can use the such kind of drug by using the such kind of implants. So these are the we can say tablet type of implants in which having the number of drugs. Then Miscellaneous type of therapy is there for your ophthalmic purpose, like ocular ionotophoresis is there. Ocular ionotophoresis is the process in which direct, we can say, current drives ions into the cells or the tissues. So here, drug molecules carry a positive charge. They are driven into the tissues at the anode. If the negatively charged at the cathode, some ocular ionotophoresis offers a drug delivery system that is fast, painless, safe, as well as it results in the delivery of the higher concentration of the drug to the specific site. It is useful for the treatment of bacterial keratitis. This is the, you can say, ionotophoresis technique. It is a modern type of technology. By using the, you can say, various kind of instruments or the current, we can have the utility of this kind of system. Then some vascular system is there, like your liposomes and neosomes are there. So it is also, we can say, modified technology for the treatment purpose. Liposomes are the vesicle type of material which are phospholipid in nature, with the vesicle based material containing the drug inside your vesicles. Then neosomes are also there, which are non-ionic surfactant based vesicles. Then this is the structure of your liposomes. They are microscopic and submicroscopic vesicle, consist of one or more concentric spheres of the lipid layers. They are separated by water or aqueous buffer compartments. So nowadays they are, you can see, utilized for the parental purpose also. Neosome structure, non-ionic surfactants based vehicles. They are formed from the cell assembly of non-ionic amphiphyllars in the aqueous media. It is resulting in the closed bilayer structures. Some advantage of neosome and liposome, that they can be made as a sustained release type of material. So for the longer period, we can deliver the drug inside your eye. They can protect from the degradation. They are completely biocompatible and biodegradable and non-immunogenic, and they can entrap both hydrophilic and lipophilic drugs. The bilayer of it can be efficiently penetrate the cornea of the eye. They have low toxicity because of their non-ionic nature.